Open the femoral canal with a 9.5 millimeter intramedullary drill. Slide the intramedullary rod of the assembly into the femoral canal until the alignment guide contacts the distal femur. Orient rotation of the assembly neutral to the posterior condyles and impact one or both of the floating spikes into the distal femur. Using non-headed pins, pin the distal femoral cutting block to the anterior femur using the holes marked 0. Once adequate distal resection is noted, an additional headed or non-headed pin should be placed obliquely to provide additional stability. Unlock the lever on the valgus alignment guide. Remove the intramedullary rod and the valgus alignment assembly using the universal extractor. Only the distal femoral cutting block should remain on the femur. Resect the distal femur and remove the cutting block. Flex the knee approximately 90 degrees so the posterior condyles are accessible. Choose appropriate left or right sizing guide. Position the sizing guide flush against the distal femur, making sure the posterior paddles are contacting the underside of both posterior condyles. Once the correct position of the sizing guide is established, place a pin through the lateral pivot pinhole located in the posterior lateral corner on the face of the sizing guide. Adjust the external rotation of the sizing guide to be aligned anatomically with the epicondylar and/or AP axis. This can be achieved by turning the rotational adjustment knob clockwise 0 to 6 degrees using a hex screwdriver. Once rotation is set, sizing can be established either by fixed posterior referencing or adjustable referencing. Ensure that the anterior surface of the sizing guide is set in the 0 position. Position the sizing guide stylus so that it contacts the lateral ridge of the anterior femoral cortex. Determine the size of the component from the graduations on the shaft of the stylus. In this example, a size 5 is shown. If the indicated size is in between sizes, you can turn the upper hex screw to shift the anterior surface up to an additional 4 millimeters to the next smaller size or down an additional 2 millimeters to the next larger size. Once the appropriate size is selected, turn the locking hex screw to lock the anterior surface and drill holes into position. Drill the locator holes on the anterior face of the sizing guide to set position for the cutting block. Remove the pins and sizing guide. Position the fixed spikes on the AP cutting block into the pre-drilled holes. Ensure that the cutting block is flush with the resected distal femur. Several holes in the AP block allow for fixation. Place one pin centrally through one of the middle holes, just medial or lateral to the quick connect attachment. For additional stability, a headed pin may be placed through the holes on the medial or lateral side of the block. Complete the anterior, posterior, and chamfer cuts. To maintain block stability, the anterior chamfer cut should be completed last. Place the arms of the extramedullary alignment clamp around the ankle and adjust the distal ML slide directly over the middle of the tibio-talar joint and proximally the second toe. The cutting block on the proximal end of the assembly should be proximal to the tibial tubercle. Impact the longer spike of the spike fixation rod into the proximal tibia. Assess rotation of the alignment guide and slope of the cutting plane. The goal is to align the extramedullary alignment assembly rotationally so that it aligns over the medial third of the tibial tubercle in the second toe. Rotational alignment is critical due to the 3-degree posterior sloped cut. The slope can be adjusted according to the patient's anatomy. Impact the second spike to secure the assembly. Attach the tibial stylus to the tibial cutting block by inserting the stylus foot into the cutting slot. Lower the cutting block until the stylus touches the low point on the less affected side of the tibia. The stylus can be adjusted for a 9, 11, or 13 millimeter tibial resection by twisting the knob on top of the stylus. Pin the tibial cutting block to the tibia by inserting pins first through the central holes, then the oblique hole. To remove the assembly, Release the cam at the top of the alignment tube. Loosen the thumb screw and use the slap hammer to remove the spiked fixation rod. Cut the tibia by first directing the blade in the posterior direction and then laterally. Check alignment and balance with the spacer block and rod. Balance ligaments in standard fashion. Attach a quick connect handle to a stemless trowel one size below the femoral component and place on the cut tibia to assess coverage. As needed, additional sizes should be templated using the stemless trowels. Once the appropriate size is determined, pin the medial size of the trowel with a short-headed pin. Flex the knee to 90 degrees and insert the femoral trowel using the femoral trowel impactor. Use the appropriate insert trowel to determine stability and alignment. Perform a trowel range of motion. The alignment marks on the front of the femoral and tibial trowels should line up. The quick connect handle may be attached to the tibial trowel and used to set the rotational alignment. Another option is to extend the knee fully with the handle attached to the tibial trowel. Pass the extramedullary rod through the handle to assess full leg alignment. Mark correct tibial rotational alignment on the anterior tibia using a cautery knife. Prepare for the tibial stem using the 11 mm tibial drill and select the appropriate tibial fin punch to prepare the fins and punch through the tibial trowel. Put the insert trowel and patellar trowel into place. Perform a trowel range of motion to assess patellar tracking. Medial-lateral placement of the femoral trowel can be adjusted to optimize patellar tracking. For cruciate retaining femorals, prepare the femoral lug holes through the femoral trowel with the femoral lug punch. Remove the tibial trowel. Attach the end of the universal extractor to the femoral trowel and remove from joint. Pin the femoral trowel through the anterior flange. Attach housing resection collet to the femoral trowel by sliding the collet anterior to posterior into the slots on the distal face of the femoral trowel and threading the two posts into the trowel. Attach the housing reamer dome and the PS reamer sleeve to the patellar reamer shaft. Ream through the housing resection collet in both the anterior and posterior positions until the depth stop contacts the collet. Impact the housing box chisel through the housing resection collet to square the corners of the box. The chisel should be used anteriorly and then posteriorly to ensure that the full length of the box is prepared. Select the matching size femoral trowel cam module. Insert the arms of the cam module into the anterior aspect of the femoral trowel box and rotate posteriorly until seated. Apply cement on the proximal tibia and/or the implant and seat the tibial implant with the tibial impactor. Remove excess cement. Apply cement to the femoral component or prepared bone, based on the surgeon's preference. Place the femoral implant onto the femur and use the femoral impactor to fully seat the implant. Remove excess cement. Place the tibial insert trowel onto the tibial implant and extend the leg to pressurize the cement. Assemble the patellar cement clamp to the patellar reamer guide. Apply bone cement to the patella. Place the patellar implant onto the patella and clamp into the bone. Remove excess cement. Determine the correct articular insert thickness. Clear any debris from the locking mechanism and slide the insert into the tibial base plate, engaging the locking mechanism. Attach the articular inserter extractor to the tibial tray and lift the inserter superiorly until the anterior lip of the articular insert is fully seated.